Murray McInerney here at the VMIAC conference in Melbourne, the Victorian Mental Illness Awareness Council, and I have the new chair of VMIAC here. Would you be able to introduce yourself, please, Tricia?
Yes, as was said, I'm the new chair of VMIAC. I've been on the Committee of Management for a couple of years and have just stepped into this role. And I am finding it extremely exciting because I think we're at a major point of change in Victoria.
We're at a very big point of change nationally too. So we've had a number of reports come down this week and coming up in Victoria. Can we talk first about the Productivity Commission report that came out yesterday on mental health? What's your response to that?
Well, I think it's a good start. I think it's always good when people tell you what the problem is and what they think should be done. We've got a lot of those reports over the years and not much has been done. So it's really going to be a challenge, a sort of a throw down the gauntlet in some ways for Hunt. And I think COAG needs to pick this up, the health ministers, to deal with it. I mean, I think some of the things that were being recognised were the need for a greater community response, a broadening of the type of responses in the mental health area. And I think the other thing that was really important was a recognition that we need to intervene earlier in people's lives, that it's no point waiting till people are 35 and right on the edge, that sometimes we know well in advance what needs to happen.
The Minister Foley, the Victoria's mental health minister who was here this morning, he talked about the need for the consumer voice to be central in the mental health system. Do you think the Productivity Commission has understood that?
I think the Productivity Commission said it, but not in the same way as Minister Foley. He sees it as being central to the future. I think the Productivity Commission's words, and I can't quote them, were more about need to be involved. And I think there is a significant difference between central and need to be involved.
And does that concern you for what will be the
I think
the
it's
decisions?
a starting point. At least we need to be involved. It's really, in some ways, up to us to ensure that the way we are involved is central.
Right. Now, moving on to Minister Foley, because of course his presence here today was very good in the sense that later this month the Victorian Royal Commission will hand down its report into mental health. What did you draw from his comments today?
Well, the report that they're giving at the end of November is actually an interim report, which then is available for consultation over the next 2 or 3 months. Always difficult when it comes just before Christmas, and how you get those consultations together. However, in other conversations we've had with him and his speech today, which was off the cuff, he didn't go by the notes he had, but he has made a very strong commitment to consumer-driven development, redevelopment, and change. So when he says consumer voice is central, I believe he actually means that. It's a big ask because there are obviously groups that benefit from the current system and are not going to want to give that up easily. But I think if the Minister stays true to what he's saying, the consumer voice, not just consumer voice, but consumer leadership has huge potential.
Do you think the Royal Commission has also got a similar approach? There was concerns at the beginning that they didn't have a commissioner with lived experience.
Yes, and we still have concerns about that. And I think the Minister could have changed that. We don't know what the Commission's going to say. We are hopeful, but we don't know.
Anything else you'd like to say out of the conversations over the past few days?
Just that I think that the consumer voice is strengthening. We're becoming more sophisticated in the way we engage, and our AGM is in a couple of weeks, and we have spaces on our committee. We are looking to broaden the base of the committee. We would like more people from non-English speaking backgrounds, from different cultural groups and Indigenous communities. We want to spread the voice, that we're not just white middle class people on the committee. It's important that we have a broader base.
You made a particular comment about what we can learn in mental health from Indigenous communities.
Yes, I feel very strongly, having worked with a number of Indigenous women over the last 10 years on various issues. I think that our spiritual connection to the land, and that's true of all Indigenous peoples across the world, but in Australia, we have a very strong and powerful model of connection to land that I think would assist us when we think about mental health.
Thank you very much, Tricia.